Hey everyone, Bridget here at the AAFE Training Center. We are doing some neurotoxin on my patient. So we're going to be treating her frontalis, glabella, and crow's feet. So I'm going to go ahead, and I did not mark her up this time, so I'm just going to go straight in with my neurotoxin. I came up with her dose just looking at her movement, the set of her eyes. She does have a little bit of hooding, so I did go a little bit heavier in her glabella and crow's feet. This is actually her first time getting her crow's feet treated, so she was very excited to do that. She has gotten a lot of smooth threads in her glabella. She used to have a really deep crease, which we can put some sort of before and after together so that you can see. But it is dramatically improved, and she's kept up with her tox every 3 months. And then her smooth threads, usually we do it at the same time. This time she just didn't want to be super bruised, so we decided to skip it this time. But usually she also keeps up with them about every 3 months or so. So I do a pretty hefty dose in her glabella just because I don't want that line coming back, but it's drastically improved. So we're really happy with her result. So she had never gotten anything done before, and that was really her only main concern coming to me. And now we've started dabbling in other treatments, so I'm really excited. Biggest thing when I treat her glabella, obviously, I always want to protect my orbital rim. That can prevent any leakage of the product down into the eyelid muscles. And then I always want to make sure that I'm careful about my depth, because if I'm too deep, I could be in my frontalis, which could then give her a brow drop. So I definitely don't want to give her any ptosis, so I'm going to stay really superficial on those lateral corrugators. I do a 5-point injection on her, which really helps kind of those tails from moving. So like I said, we keep up with this every 3 months to kind of keep that line still. So now going around her eyes, I do a pretty hefty dose on her. Like I said, I wanted to get them pretty still. This was her first time, so her lines are a little bit deeper in the crow's feet. And like I said, she also has hooded eyes, so she can use that lift. Especially laterally. Obviously, the medial is going to be lifted from treating her glabella, but I really wanted her to start treating her crow's feet, one, for prevention of crow's feet, but also to give her a little bit more of a lift. So we'll take off any heaviness from the forehead that she feels. So I kind of try to keep the frontalis a little bit on the lighter side, whereas these other two areas, I try to go a little bit more aggressive on most of my patients just because they are depressors. So they're going to do the opposite. And then I'm also going to do a little bit in her brow lift. So that's really going to help lift the tail of that brow and keep things nice and lifted. So it's just treating the orbicularis oculi muscle just further up into the brow. So it's still the same muscle as the crow's feet, but I can treat it a little bit further up as long as I see some movement there. Thanks so much for watching, and I hope this helps.